Elaine Stillerman, the developer of Mother Massage, Massage During Pregnancy professional training courses, and I'm here today at Oakworks to talk to you about carpal tunnel syndrome and de Quervain syndrome, which affects the thumb during pregnancy and postpartum recovery. There are 3 pregnancy-specific causes of carpal tunnel during pregnancy, and they are the posture, a protracted chin, the swelling of the arm, and the effects of relaxin on the flexor and extensor retinaculum on the wrist. So here's Dana, who's just about to have her baby, and I'm going to show you what posture does to the integrity of the strength of the arm. So we're going to start doing a muscle test with your right arm dominant. Okay, we're going to bring the right arm up and you're going to stare straight ahead, and I'm just testing the muscle in the clear to make sure it's a good strong muscle. So I'm going to push down and you're going to resist, and it's a small resistance, and resist. Okay, it's a good strong muscle to use. Now, just like you do when you stand up because you're in that pregnancy state of mind, just bring your chin out ever so slightly and resist. She can't. And bring your arm up again, bring your chin back, retract your chin, and resist. There you go. This happens to massage practitioners also, thank you. This happens to massage practitioners when at the end of the day you're massaging with your chin jutting out and you get tired in your arms. You need to remember to retract your chin. Also, spending time at the computer or driving for long distances often causes the neck to jut out. You want to bring your chin back. This decompresses the lower cervical vertebrae, which of course feed the arms. Since one of the causes of carpal tunnel syndrome during pregnancy is excessive swelling, we're going to treat the arms using lymphatic drainage. Lymphatic drainage always starts on the neck. It's done slowly and rhythmically. We're going to be using about 10 to 30 grams of pressure, which is about the weight of a quarter. We're working proximal to distal. We use no lubrication because it's important that you get the skin to stretch. That activates the initial lymph vessels to reabsorb the fluid. So starting from the neck, we're going to work proximal to distal with a slight scooping or J-hook kind of a stroke. And we just do a few passes. It's very gentle, it's very light. This is part of your neck massage, which you throw in at the end, wiping off any excess lubrication so you can get the nice stretch into the skin. We also want to educate mom about using proper body mechanics, keeping her neck back and keeping her wrists neutral. And when she has her baby, to nurse the baby by bringing baby to breast, not breast to baby, and keeping her wrists neutral. And when she lifts the baby, not to flex her wrists, but to keep her wrists nice and straight. So now we're going to be doing lymphatic drainage, making sure that we don't compress the breast tissue. We always start proximal and work our way distal. The stroke always ends proximally. So we Velcro our fingers to the skin, stretching the initial lymph vessels, using 10 to 30 grams of pressure. Stretching the skin. This allows the initial lymph vessels to stretch and act as a hydraulic pump, which reduces the swelling in the extremities. Take it all the way down the arm to the hand. The lumbricales. And then another pass. How does that feel?
Very nice.
Nice and relaxing, very soothing. This is appropriate body work. When you go too deeply and there's swelling, you're bypassing the lymph system and you're not going to be affecting the lymph drainage at all. You might actually cause a histamine response, which will add to the fluid. So it's important to use the appropriate body work technique. Taking this all the way from proximal to distal. And then the lymphatic compression, just relax your arm. It's a slight hold, which allows the lymph vessels, the valves of the lymph vessels to close. And sometimes you can actually feel the limb shrinking under your hands. It's a scooping up, and you hold each compression for a count of 10. But don't let the word compression fool you. We're not getting any deeper with pressure. All the way down. We then follow the lymphatic drainage with connective tissue release. So we're going to remove this for just one moment. Get this out of the way. Keeping the wrists neutral, just turn your arm over. We're going to be stroking down, tractioning the wrist and stroking down. Let's flex your elbow a little bit more. That's better. A nice stretch of the connective tissue. And what gives you that counter stretch is the tractioning of the wrist. How's that feel? Good. Real good. Now we're going to see some hyperemia coming to the surface of the skin. That's exactly what we want. And small little flicks just inferior to the elbow, at the top. This allows the nerve to pass through the sheath unimpinged and freeze the nerve. You can see the nice reddening there. There are two acupuncture points that I also use. Large intestine 11, which is in the belly of the brachioradialis, and small intestine 3, which is found midpoint between the head of the ulna and the first knuckle. So we grab, and this is a very powerful hand point, we grab under here and large intestine 11 at the same time. That should be a little sensitive. Holding for a count of 6, repeating 6 to 10 times. Now to stretch the palmar fascia, a lot of massage therapists like to break the popsicle. This technique is called break the popsicle. But we want to avoid flexing the wrist. So we keep the wrist neutral and just stretch outward. How's that feel? Very good. It feels very good. Thank you. I'm glad you said that. And then we take the outside fingers and stretch in opposite directions, each joint by joint, proximal to distal. Stretching the palmar fascia, getting rid of the fluid in the extremities. People who are in flexion most of the day, driving their car, typing on their computers, really enjoy this. Elderly people really enjoy this. You can understand why, yes? And then we position the top arm on her body, and here's the other arm. We can do the same technique here. I want to thank Oakworks for the opportunity to speak to you today. Thank you so much.